Did you know that over 2.7 billion people worldwide suffer from some form of vision impairment, with blindness being a significant concern? Blindness is a global health crisis that affects millions, yet many are unaware of the staggering scale and impact of this issue. Welcome to today's video. I'm Dr. Ayesha, thanks for tuning into our channel. In this video, we'll dive deep into the world of vision impairment, uncovering the challenges faced by those affected, exploring the leading causes of blindness, and revealing the steps we can take to prevent and treat this pervasive problem. Vision impairment and blindness have a profound impact on individuals' quality of life. Globally, 2.2 billion people live with some form of vision impairment, and in the US alone, about 12 million people aged 40 and older are affected, with around 1.1 million legally blind. According to a quality of life survey conducted by the American Foundation for the Blind, more than 70% of people with significant vision loss report difficulty with daily activities such as cooking, grocery shopping, and personal grooming. These basic tasks, which many of us take for granted, become enormous challenges, severely limiting independence. The social and emotional toll is also significant. Studies show that nearly 30% of people with severe vision impairment experience feelings of social isolation and loneliness, and more than 40% report symptoms of depression due to loss of independence and inability to participate in activities they once enjoyed. Additionally, vision impairment often leads to increased anxiety about safety, particularly when navigating public places. Accessibility remains a major concern, especially in public transportation, where only 55% of visually impaired individuals feel confident in their ability to travel independently. The combined effects of limited access to essential services and the emotional strain create an uphill battle for many who live with vision loss, making comprehensive support and services crucial in improving their quality of life. Blindness can result from a wide range of causes, some of which are preventable with early intervention. Diabetic retinopathy, for example, is one of the leading causes of blindness among adults in the US, especially in people with unmanaged diabetes. In fact, nearly 30% of Americans aged 40 and older with diabetes show signs of diabetic retinopathy or bleeding. Stay tuned for our detailed video on diabetic retinopathy next month, since it is a diabetic month. Glaucoma, another leading cause of blindness, affects over 3 million people in the US, with many unaware that they have it. Due to its gradual onset and lack of early symptoms, people don't think that they have glaucoma. Please watch our detailed video about glaucoma to learn more. Genetic factors can also play a major role. Disorders like retinitis pigmentosa cause progressive vision loss due to tunnel vision and eventual blindness, often affecting people at a younger age. Stargardt disease, which typically appears in childhood, causes progressive central vision loss. While peripheral vision remains intact, central vision deteriorates over time, making tasks like reading or recognizing faces increasingly difficult. Additionally, albinism, a genetic condition characterized by lack of pigmentation in the skin, hair, and eyes, often leads to significant vision problems. People with albinism usually have poor visual acuity and are sensitive to light due to underdeveloped retinal structures and abnormal nerve connections between the eyes and the brain. Although not all individuals with albinism are legally blind, many experience lifelong visual impairment. Leber congenital amaurosis, or LCA, is another rare genetic disorder that affects infants and leads to severe vision loss or blindness from birth to early childhood. LCA affects the retina, and while it is rare, it is one of the most severe genetic causes of childhood blindness. Vitamin D deficiency, although not a direct cause of genetic blindness, is linked to several eye health issues, including a higher risk for macular degeneration, which can lead to vision loss later in life. These genetic conditions highlight the importance of early diagnosis and intervention. While some forms of vision loss are currently untreatable, genetic testing, early detection, and ongoing research into gene therapy offer hope for potential treatments in the future. Injuries and accidents also contribute to blindness, particularly in industries where workers are exposed to hazardous conditions without adequate eye protection. Blindness can stem from various factors, including genetic conditions that often manifest at an early age, which is why dilated eye exams should start as young as 6 months of age. Early diagnosis is a key for proper treatment and better prognosis. Luckily, there are several preventative measures that can be taken to reduce the risk of blindness and vision impairment. Regular eye checkups are crucial as they can catch early signs of conditions like glaucoma or diabetic retinopathy before significant damage occurs. The American Optometric Association recommends that adults have a comprehensive eye exam every year or more frequently if they have underlying health conditions or are at risk for eye diseases. A healthy lifestyle also plays a key role in maintaining eye health. A diet rich in vitamin A, C, and E, along with nutrients like omega-3 fatty acids, can help protect against age-related eye diseases. Regular exercise helps reduce the risk of conditions like diabetes and high blood pressure, both of which can contribute to vision loss. Lastly, protecting your eyes from harmful UV rays by wearing sunglasses with UV protection. In another video, I discussed how to prevent eye injuries at workplace. In addition to eye exams, genetic testing can become an essential tool for early diagnosis and managing conditions that can lead to blindness. For example, if there is a family history of Stargardt disease, LCA, or retinitis pigmentosa, genetic testing can identify whether someone carries the gene mutations responsible for those conditions, allowing for early intervention and better management of the symptoms as they develop. Early diagnosis through genetic testing is crucial because it can inform treatment options, clinical trials, and potential gene therapies currently in development. So, by combining regular eye exams, genetic testing, healthy lifestyle choices, and protective measures, individuals can significantly reduce the risk of vision loss or manage conditions more effectively if they arise. As we've discussed throughout this video, blindness is a pressing global health issue that impacts millions of lives. So what can you do? Start by sharing this video to spread the word about the blindness crisis and the steps we can take to combat it. Advocate for increased resources and accessibility in your local community. Most importantly, be mindful of the challenges faced by the blind and visually impaired, and do your part to create a more inclusive world for all. Together, we can shed light on this crucial issue and work towards a future where nobody has to needlessly suffer from preventable vision loss. If you haven't already, make sure to subscribe and hit that notification bell for future eye-opening videos. Thank you for watching, and remember, your eyes are precious, so protect them well.